coming to ePharma for quite a while, a couple of years. A lot of great discussions, a lot of great talks, a lot of innovation happening. What's really nice and what's trending for the past couple of years is moving away from the typical pharma aspects and initiatives to really seeing what's out there beyond pharma, to bring that into our healthcare community and try to learn from other experiences. And I think that really is what's pushing forward the healthcare community and pharmaceutical companies in itself.
My name is Don Kim. I am a strategist with Neon, an FCB agency. And I enjoy coming to ePharma because I think it's a great opportunity to interface with other professionals in the healthcare advertising space and just to kind of learn about what other clients and other vendors are doing in this space today.
My name is Anna Stashauer, and I am the founder and publisher of PM360 magazine for pharmaceutical marketers. And I love coming to these conferences because you have to keep learning in this business. It moves at rapid pace, and I love the opportunity to interact with people who I know and who I don't know. So it's a great conference, highly recommended.
Hi, I'm Mike Moret. Excited to be here for day one of ePharma. This particular session, Track C, has been fantastic, sponsored by Startup Health, and they've brought a range of really innovative early-stage health and tech companies to the equation. So it's been really fantastic to hear their perspective on the landscape, what specifically they're disrupting. Personally, I was able to speak on behalf of Cohero Health today. Also really enjoyed hearing more from Stu at ZipDrug, Linda from Curatio, and a range of all of these really entrepreneurial innovators. So exciting all around, and looking forward to seeing what day two has to offer here at ePharma. Thank you.
Well, basically, there's a real diversity in the programming so that pretty much anybody who's here can find things that are fitting within the interests of their day-to-day job. So if you can't find content, you probably shouldn't be here. But there's such a diversity that it's pretty hard for anybody in the digital environment not to find some things that are well worth their time. D&D has been a sponsor for a fair number of digital events, and basically we find it's a great way to interact with potential clients. A lot of them are clients as well as prospects in a way that gets them out of the office. They're a little more relaxed, and the interactivity with that kind of an audience is a lot more productive in this kind of a setting. So we find it very constructive for our relationships.
What I love about ePharma is it's so diverse. There's many different topics, and that are all really applicable in their own way. And I love the fact that it's customizable to whatever you're interested in. So I think having the day broken up like they did on the workshop day for the first day was really, really convenient and very educational.
How's everybody doing? I'm Jeff Osuji. I'm over client partnerships at blackdoctor.org. We're the largest consumer health website. And what I really like about this conference is the ability to really meet with our current existing clients, as well as nurture and build new relationships with new client partners. The sessions are also very insightful. You're able to learn a lot about what your client is actually experiencing so that you can speak intelligently to them about their brand. And so it's always a great time to come and connect with new and existing partners.
It's my first ePharma conference. I think the audience, the topics, the opportunity to learn about what successful practices look like in this industry from a digital perspective in this complex environment of regulations, patients, doctors, changing channels. I think it's a great learning environment for both clients who are inside the industry working to serve their physicians and patients, as well as media companies and service providers and agencies as well.
Hi, I'm Kristen Coppins. I'm here at ePharma on behalf of ePharma, blogging and providing live social media coverage. I myself am a patient advocate, and I think it's very important to have that patient representation at healthcare conferences because I believe that the patient voice is something that we're still striving to hear and bring to the table. So I'm excited to offer that and see what other people are able to offer.
Hi, I'm Kirsten Schultz, blogger of Not Standing Still's Disease and arthritis introspective outreach specialist. I am here at ePharma Summit 2016. On behalf of ePharma as a patient blogger, giving a patient perspective. I'm really excited to be here to learn a little bit more about the pharmaceutical companies, about different strategies that are used, and hopefully to hear some more information about a response to the direct-to-consumer advertising ban AMA is calling for. Yeah. Probably the best thing about Workshop Day was just hearing the multiple perspectives that are out there, whether that's about marketing specifically or about the different entrepreneurs that are out there trying to help correct or strengthen some of the issues that are out there in healthcare and pharmaceuticals.
I'm Dave Hoy from Coup Entertainment. I'm here today with LifeScript. We're launching a new video content product, and I'm probably not the typical attendee of the conference here. We're a video production company, but this is a great place to go and talk to people about what the needs are in the industry in terms of content and engagement and entertainment and storytelling. So that's why I'm here, and also to support my partners at LifeScript and this new product that we're launching, Life Unscripted.
Hey there, this is Joe Susky from Doximity, just saying hi. Really enjoyed Steve Case's presentation today on his fireside chat on how growing from a startup to an established business, and it's nice to bring those outside of pharma perspectives. I also liked the initial speaker on how he beat cancer. I think it's really helpful that we're talking about bringing the patient's perspective. Quite often we talk about patients as someone to market to, but actually bringing the human element has really been helpful to making this a lot more personable enterprise. But yeah, great event. Good to see some old friends as well, and can't wait for next year. Thank you.
So people should come to ePharma because every day we go to work, and unfortunately often we deal with the small things. This is one of the only places where we can think about the future as it relates to digital and health. We all come together and talk about that, so how we can improve patient outcomes overall.